here's a video by the makers of Gamma Knife, and kind of shows you kind of a video of exactly how it delivers its treatment. And I'll kind of go over it with you. So this is the actual Gamma Knife unit that we have here at Monmouth Medical Center. Patients lie on this table, head again over here. Here's the helmet that we talked about. So once we have the patient secured to this position, the head and patient will slide into the machine. It'll mount onto this table, and patients will have exposure of 201 radiation beams. The patient may move out of the table, and then what's called the APS system will move the head with, again, sub-millimeter accuracy to treat different portions of the same lesion. So the patient may come in and out of that machine once small shifts are made. So if you have a tumor that's, for example, 8x4 and you're treating with 4s, you may end up using 2 4s. And so patient will go into the machine, treat half of the lesion, come out of the machine. The APS system will move the patient over, slide back in, and treat the other 4 millimeters, just to kind of give you a simplistic view of how it delivers its treatment. And again, like I said, helmet, you can kind of see how small a 4 millimeter orifice is. So each of these represent a radiation dose delivery site. So each of these have a 4 millimeter opening, and all of these, if you shine a flashlight against every one of these lights, it'll point to a single point in space. And this thing over here, which never touches the patient, weighs about 400 pounds, so it's full of lead. Again, more of the same. So once the radiation is delivered, again, patients feel nothing. The radiation beam does not hurt. You don't feel it. You don't see it. I'm your DJ. I'll ask you what music you like to listen to, and we'll put it on. And you'll listen to that music during the radiation course, maybe anywhere between 30 minutes to a couple of hours to deliver a treatment, depending on how large of a lesion, how many lesions, and how complex the lesion is. Once the delivery is delivered, we take the patient off the table and we take the head frame off. We may put a couple of Band-Aids on the head. My nurse has a sense of humor, so she has Looney Tunes Band-Aids. So we have patients walking out with Bugs Bunny Band-Aids, which is pretty funny. Patients will come back to me a week later, and we'll take a look at the pin sites and make sure that there's no issues or problems. Typically, there's no bleeding. Patients can be on blood thinners during this procedure. We treated a patient a week ago on active Coumadin because of blood clots, and we never took her off of it, and we took the head frame off. There was no bleeding whatsoever. So this can be done on anticoagulants or blood thinners without issues. And that's all I got. So this is, again, a very precise, technologically advanced, but very, very conditioned and experienced treatment device that serves as another tool of treating brain tumors. In patients with primary brain tumors who have gliomas or glioblastomas, we may treat patients who have had recurrence after standard radiation therapy. But we use it in cases where we can define a target on imaging, whether it be MRI or CT, and we know that that lesion alone is all we need to treat. So for example, I get this question all the time, which is, with a patient with a glioblastoma multiforme, why can you not use the Gamma Knife for me when you're telling me I can treat it with such precision and such accuracy? And it's because, as Dr. Weiss had mentioned, glioblastomas have sort of these little tentacles that you can't see on an MRI. So you need to treat not only the tumor, but you need to treat normal tissue around it with a good margin around it to ensure that you cover cells that you may or may not see on an MRI. We may treat a glioblastoma after they've failed from standard radiation treatments, where we see sort of a single focus where we can kind of target and say, this is the site where the patient has recurred, and we can blast that small area. Serves a great purpose in those situations, but we certainly don't use it in primary first-line therapy for those types of lesions.